right, so hi everyone. Thank you very much for joining. My name is Mahika, and I'm here representing the Virtual Med Society. The Virtual Med Society is a student-led organization who helps aspiring medical students with their journey to medical school. And today we bring you our fourth webinar of the year, hosted by Sanjana and Archie, who are both students that have experience taking the UCAT and have graduated high school and have applied to medical school this year. So the webinar today is going to be about situational judgment in the UCAT and how to improve your score and how to get top bands in the situational judgment section. Coming back to Virtual Med Society, I just wanted to point out some things that we offer as an organization. First of all, we have things like the monthly newsletter with medical ethics information, university information, and exclusive doctor interviews. We offer webinars, virtual doctor shadowing, and we recently started a YouTube channel where recordings of our webinars will go to. Our next webinar will be hosted on the 8th of August, and it will be about strategically applying to med schools based on your UCAT score. And all of this information can be found on our Instagram. And if you would like to sign up to these webinars, then become a member of our society and you'll receive emails with the link to register for these webinars. Now, sometime during the webinar, I will be posting the link to become a member and all of our Instagram handles, our social medias, so you can make sure that you're up to date with all of our events. So enough from me, I will be passing it on to Sanjana now. Remember that during the webinar, if you have any questions at all, just pop it into the Q&A section and both of them will be answering them towards the end, I'm pretty sure. As well as that, Sanjana and Archie have created a feedback form and they would really appreciate if you guys could fill out the form. I'll be posting the link to that form as well sometime during the webinar as well. That's it. Thank you, and over to you, Sanjana.
Thank you, Mahika. Thank you so much. So, hi everyone, good evening. Today, Archie and I will be covering situational judgment. I'm just going to give you a little overview, after which Archie is going to talk about top 4 topics which are related to situational judgment, and then I will cover the rest of the 4 topics. So starting with what the situational judgment test really is, it just measures your capacity to understand real-world complex situations when put into those complex situations, and it helps you identify critical factors and identify appropriate behavior in dealing with those situations. It is assessing your team working skills, commitment, your compassion, your resilience, and adaptability. The format is this: 69 questions will be asked in 29 minutes, so you get around 42 seconds per question, and it's a pretty convenient test. Most people don't face time constraints because you have one scenario that gets asked up to 6 questions. You have as little as around 2 questions per scenario. 3 main different types of questions. You have appropriateness questions, which are the most in quantity than the importance ones, followed by the drag and drop. I will give you one example of the drag and drop towards the end as well. But now I'm gonna move it forward to Archie. And after the 4 topics are done, we'll be taking questions with regards to those 4 topics, and then we'll move on to mine.
So before we begin sections and a few examples, I just wanted to give a common tip. So every situation has at least 2 aspects, and if the correct option or if the option addresses both those aspects in a positive manner, then the answer would be very appropriate or very important. If it affects both those aspects negatively, then it's very inappropriate or not appropriate, not important at all. And if it's anything that is not answering both the aspects or how many other aspects there are, then it is either of the remaining 2 options. You won't go for the extreme options, which are very appropriate or very inappropriate. And you always should decide which half the answer belongs to, and then decide the degree of its appropriateness or importance. So we'll see this through the questions that we discuss. So the first section is about confidentiality, which is very important because as a doctor or as a healthcare worker, you will always have to maintain patient confidentiality. All patient information is treated confidential even after their death. So unless the next of kin or their power of attorney does not want personally informs other people about their death, you as a doctor cannot tell their friends or their other family about the patient's death as well, because it's treated as classified information. And when you're publicly communicating about a patient, provided you have their consent, always try to make sure you're not presenting any identifiable information. Just try to be vague about their identity and be more specific about the medical aspects of it. And there are a few situations where you have to be mindful, which is about the publication of patient information on social media. This should never be done without consent. Even loud discussions in public places should not be held, because you don't know who might hear. You should also not take confidential information home. It must stay in your workplace or in the hospital. And if you do take it home, make sure you return it back to the hospital as soon as you can. We'll talk about a few do's and don'ts about confidentiality, especially in case of a breach. So, if there is a breach, maybe let's say there are two doctors who are talking about a patient, and you overhear them, and you see that a lot of other people can identify the patient because they've used certain details. So, what you should do is you should stop the breach as soon as possible in a very discreet manner and do not draw more attention to the matter. And apart from that, you also need to make sure that the people who have committed the breach are informed of their mistakes, that they never repeat it. And mistakes like these should definitely be informed to the patient, and you need to apologize, or whoever has committed the breach needs to apologize to the patient. And to prevent any future breaches, this incident needs to be reported to the right authorities. And instead of you reporting it, you should encourage the offender to report it themselves, so that they understand their mistake. In case of the things that you definitely should not do, is first ignore the problem and wait for someone else to handle it. If you see it happening, then it's definitely you're also accountable for it. So make sure you don't just ignore it or walk past it. And do not play the blame game, because over here, what we're worried about is the confidentiality of the patient, not about whose fault it is. So even if it's someone else's fault or your fault, make sure you take accountability of something that ultimately will affect the patient. And the rank or the position of the person committing the breach is not important at all. So even if it's your senior, someone who's marking your assignments, or if it's your junior, you need to make sure you take the right steps in all cases and keep the patient's confidentiality of utmost priority in your mind. Now we'll go through a few examples. If you want, you can answer the questions in the chat so that I can see
Yeah, you
whether
can
you're
give it, you can
understanding.
put the answer in the chat box.
So the first example is Rahul is walking to the cafeteria of the hospital during his lunch break when he notices two doctors loudly discussing a patient's surgical options outside the doctor's mess. The two doctors seem to be in disagreement and are focused on arguing their point. As such, they've not realized patients and others walking by are stopping to listen to their conversation. Although they have not mentioned the patient by name, he recognizes who they're talking about from other identifiable information that they have mentioned. How appropriate is each of the following responses by Rahul to the situation? So, the first thing you need to see in these kinds of questions is whose point of reference are we taking? Over here, we have to think in terms of what Rahul would do, not what the doctor should do or any of the other passerbys should do. So, remember, you are Rahul over here. The first thing that he could do is he could shout loudly at the doctors, telling them to stop. So, I've already seen a response in the chat. Uh, okay. So, if you have answered, I'll wait for 10 more seconds. Okay, so I'll discuss the answer now. The answer would be C, inappropriate but not awful. So the tip that I gave you before we started the confidentiality section is that every question has at least two aspects. So in this question, the two aspects, number one would be that the patient's details are being leaked, and number two would be that the doctors need to understand what their mistake is, so that they don't repeat this in the future. So, by shouting loudly at the doctors and telling them to stop, Rahul is addressing the first aspect of it. He is making sure that no more patient information is divulged by the doctors. So, he is ensuring that further confidentiality is maintained. However, he's not doing anything to address the second factor, which is that the doctors need to realize what mistake they're making, so that they don't repeat it in the future. So here, shouting at them will definitely get them to stop talking about the patient, but it's very inappropriate. It's not very inappropriate. So you can say it's inappropriate, but not awful. we'll move on to the next question. He could interrupt their argument and point out that they are creating a crowd. So can you answer this in the chat? Okay, so I've gotten a few responses over here, and I think you guys understood the point that I was trying to make. So over here, this is definitely a more civil approach instead of just yelling at them and creating a scene. So interrupting their argument would be good because they are making sure that the patient's details are secure and pointing out that they are creating a crowd. However, okay, this is correct that he should tell them that there are other people listening to them. But again, the core point over here is that the doctors are not taking accountability of the fact that there are patients who have trusted them with information. So he has done nothing to ensure that the doctors understand their mistake. So while this is appropriate because he's being polite about it and he is making sure that the patient's information is not further put out there, it's not entirely appropriate because he is not addressing the second aspect. So the answer would be appropriate but not ideal. Now, the next question is explaining to the onlookers that this is not how most doctors typically behave. So, do you want to answer this in the chat? Okay. So again, I guess most of you understood this. This is obviously a very inappropriate thing to do because he is addressing neither of the two aspects. He is not stopping the breach by interrupting the doctors in any way, and he's also not telling the doctors that what they're doing is wrong and they should, be more professional. On the other hand, he is even kind of spoiling the reputation of the medical profession by saying that this is not how doctors typically behave. These are an exception to the rule. So obviously, this would be a very, very inappropriate thing to do. Now, the second section of SJT is about professionalism. So some examples of unprofessional behavior include being uncommitted to your work, lacking engagement, and not attending class. This is very important, not attending class. You should always attend class and prioritize your course over any other extracurriculars. Failure to accept and follow educational advice and unwillingness to learn from feedback given by others. So, as a student, you are obviously going to receive a lot of feedback from your teachers, from your peers, from your education counselors, from your supervisors. And if you're unwilling to accept that feedback and actually work on making yourself better, then that is also very unprofessional because ultimately it's going to affect your work and it'll affect the patients. Then there's neglect of administrative tasks and poor time management. So a lot of times, a lot of students, they take up a lot of tasks, they volunteer for a lot of things, and then are unable to manage their time. So this would also be very unprofessional. You need to make sure that you're taking up as much as you think you can handle. And if you're having any difficulties, you definitely should seek help. Being rude or disruptive, I don't think I have to explain this. Any form of harassment or bullying and aggressive behavior is completely, it's not tolerated at all, and you might be expelled from from your schools for these. Now, in case of professionalism questions, or let's say a person is acting in an unprofessional way. So factors that are not important to consider is about whether or not they would get caught. If they get caught, or even if they don't get caught, it is your job to do the right thing. So make sure you don't shy away from your responsibilities. Whether or not you are directly involved in the act does not absolve you of any responsibility. If you know about it, you are accountable for it, and you should take the necessary precautions and steps. What others might think of you is also not important. However, this might be of minor importance in a team role because if your teammates think negative of you, it might affect the team dynamics. But those are very rare cases. In most cases, what others might think of you is not important at all. Your relationship with the offender has absolutely no importance. They could be your friend or they could be your enemy, and you still have to do the right thing. Prior history of a specific behavior should also not be used as an excuse for the unprofessionalism. You can't just say, oh, this person always does this, so it should be excused. Or a lot of people have been caught cheating, so this person who has been caught cheating for the first time should be excused. this is not important at all. And if you're talking about missing classes, how much you would miss from skipping class is also not important. You could learn absolutely nothing new in class, and it still makes you still need to attend your classes. In terms of what is appropriate in these cases is that you need to explain the problem to the person in question in a discreet manner. Try to de escalate the situation, do not create a scene, and be calm and reasonable as much as you can. Always give your course your first priority, even if there are some clashes with your course and the extracurriculars. Give your course the first priority. Apologizing on behalf of the offender is appropriate but not ideal, because while you are taking care of the offense that they've created by apologizing, you're doing nothing to make sure that they have understood their mistake. So again, it's appropriate because you're doing the right thing by apologizing, but it's not ideal. Instead, you should encourage them to apologize and understand their mistake, and encourage them to talk to their supervisor instead of you reporting them directly. Now we'll go through a few questions. So, first question is, a medical student, Cameron, is told by a patient that a consultant frequently swears loudly on the ward, which makes him feel so uncomfortable that he does not want to stay in the hospital. Cameron consults a nurse on the ward, and she tells him that he has not ever witnessed this behavior by the consultant. The nurse reminds Cameron that the patient might just dislike being in the hospital. Cameron is unsure what to do because the consultant is making one of his assessments. How important to take into account are the following considerations for Cameron when deciding how to respond to the situation? So, again, over here, as it's highlighted, your point of reference is from Cameron's view. So, the first factor is other patients may have overheard the consultant swearing loudly on the ward and may also feel uncomfortable. Is this important, very important, of minor importance, or not important at all? Okay, so I've got a few responses and they're all unanimous. So a lot of you have been saying that it's a very important factor. However, the answer would be that it's only an important factor. It's not a very important factor, because regardless of whether 10 patients have explained to Cameron that they're feeling upset about this behavior, or one patient has expressed their grief to Cameron, Cameron should do the right thing in both cases, and she should investigate the matter. So it doesn't matter as much whether more patients have come out to talk about the consultant. As long as there's one person who is being affected by it, Cameron needs to take the right steps. So I think it would just be an important factor and not a very important factor. Then the second factor is that the nurse has not witnessed the consultant swearing loudly on the ward. Is this very important or important? Okay, so some of you have given your answers. Again, they're unanimous. So the answer in this case would again be important, because while it's not very important to take, like I said, since one patient is being affected negatively, Cameron should take the right steps and she should investigate. However, that person is a patient, so it is also possible that the patient is not comfortable in a hospital, like the nurse said, or it's also possible that the patient is not mentally capacitous enough to understand whether he's being offended or it's all in his head. So whether or not the nurse has witnessed the consultant swearing is a very important factor. It's an important factor as well, because that will help Cameron. It makes sure that Cameron doesn't unnecessarily blame the consultant before investigating the matter. So opinions of other people are important in this case. So could you go back to the previous slide for a second? Since I told you there are always two aspects to a case, in this case, I think we didn't discuss the two aspects. The two aspects would be, number one, whether the consultant was actually swearing and whether he was actually offending the people, or if the patient was just lying about it. And number two, whether it is going to misalign the hospital's image and the image of the medical profession. So these are the two factors that you need to consider in this case. Now I'll move on to the next example. Megan is on a surgical placement with Stuart, another medical student in her year. One morning, they're helping an anesthetist to prepare a patient for heart surgery when, as soon as he has fallen asleep, Stuart makes a joke about the patient's weight. Megan finds it in poor taste and can see the anesthetist is taken back by Stuart's comment. How appropriate are each of the following responses by Megan in this situation? So the first one is, should she immediately apologize to the anesthetist on behalf of Stuart? Is it very important, appropriate but not ideal, inappropriate but not awful, very inappropriate? Okay, so I think all of you have understood this. The answer would be appropriate but not ideal, like we discussed in the previous slides as well. Because while she is apologizing and taking care of the first aspect, which is that the doctor has been negatively impacted, she is not making sure that Stuart realizes his mistake. The next question is, yell at Stuart in front of the anesthetist and the nursing team. This, I think all of you know, is a very inappropriate thing to do, because by yelling, she's just escalating the situation without actually mitigating it, and it might also hurt other people's feelings. So it's very inappropriate. Watch Stuart closely over the placement to see if he does it again. Now, this is kind of tricky. What do you think this would be? Okay, so some are saying it's C, some are saying it's D. The answer would be C. It's inappropriate but not awful. This is because it's not awful because she is making sure she is taking some form of responsibility or accountability and making sure that it doesn't happen again. But it's inappropriate because she's not doing anything to correct the situation that has already taken place. So she's not doing anything to make Stuart realize that he is in the wrong here. So it would be inappropriate, but it's not awful because she is also taking some form of responsibility. Okay. Now the next section is about teamwork, which I think is the most important section, and a lot of questions will be from the teamwork and the professionalism aspects of it, and the fitness to practice, of course, which Sanjana will get to. So teamwork, you always have to be respectful, fair, accepting, and cooperating in spite of personal relationships or disputes with some team members. You need to know your influence. So don't underestimate or overestimate your influence and your importance in the team. Make sure that you know the perfect balance. You need to facilitate equal discussion and distribute work equally. Avoid conflict and de-escalate as much as possible. Support group discussions in case of problems instead of talking to people privately so that everyone is kept in the loop. Ensure punctuality, and avoid getting an authority involved until absolutely necessary. In fact, mostly where there's an option of getting an authority involved without talking to the person in charge or to the person in the case, it's mostly just an inappropriate answer. And usually confrontation is depicted negatively. However, in a team context, confrontation can be considered appropriate if done in the right manner. So we'll go through a few examples. So the first one, Mark is the captain of the university's lacrosse team. As captain, he is expected to lead training and pick the team for competitions. While running a practice match with half of the team, he sees Will, one of the team members, sulking on the sidelines and saying he should be playing. Mark knows Will from before university and never liked him because of personal disagreements they have had over the years. How appropriate are each of the following responses by Mark in this situation? First one, should he immediately substitute him into the match? Would this be, which of the four options do you think this would be? Okay, so I think almost all of you have given the right answer. It is C, inappropriate but not awful. This is because it's not awful because he is taking Will's feelings into consideration and he's trying to be a good teammate by validating his feelings and allowing him on the team. However, it's inappropriate because he can't just say that you can play on the team just because you're sulking and just because you're upset. He has to investigate the matter further and he needs to have a proper discussion about it. Explain to Will that they are running drills and he will play soon in the match. What do you think the right answer would be for this, for the other one? Okay, have you all submitted your responses? Okay, they're still coming in. Okay, so in this case, the answer would be that it's a very appropriate thing to do because he is making sure that he is communicating with his team member over something that he is upset about. And he's explaining to him as to how since only half the team is playing right now, will be included when the entire team plays in the next match. So this is definitely a very appropriate thing to do because he is mitigating the situation while taking care of his teammates' feelings, and he's not letting his personal disagreements get into the way. This question, this option is about sending Will to the coach. Do you think this is how appropriate? Do you think this is? Okay, so there are a lot of mixed responses for this. The answer would be C. It's inappropriate but not awful. So over here, again, like any question, there are two aspects. Number one, is Will in the right to be sulking, and or is he just sulking because of previous disagreements or because he has certain misunderstandings about Mark? And number two, what is Mark doing to mitigate the situation? So by sending Will to the coach, of course, Mark is making sure that any misunderstandings are erased. And like they've already mentioned the questions, they've had disagreements in the past. So by sending Mark to the coach, by sending Will to the coach, maybe Mark thinks that Will understand the coach better than him. However, he is unnecessarily escalating the situation. So while it is not an awful thing to do because it is answering one aspect of the question, it is inappropriate. He should talk to Will first, and then send him to the coach, or talk to the coach later if required. And the next section is dealing with patients, which would be the most practically useful section once you're doctors. However, as med students, your patient contact will be rather limited. So you need to know that patient safety is of utmost importance. You need to be polite, empathetic, sympathetic, respectful, trustworthy, honest, etc. Basically, you just need to be a nice person like you are in your real life. Don't treat anyone differently, irrespective of a difference in their ideologies. Do not let your personal beliefs or personal ideologies interfere with your treatment of the patient. Remember that patients are people too, and treat them as a person, not just as a set of symptoms. Be empathetic because a patient is coming to you when they're in the most vulnerable form. And the least you can do is try and empathize with them and try and understand their plight and see them as a human being and not just as a set of set of symptoms. Someone asked whether we'll get the recording. It will be uploaded on the VMS YouTube channel. You need to work in partnership with patients to not undermine patient autonomy. If they're mentally competent, of course. If they're not mentally capacious, then you need to talk to their next of kin. And you should never pressurize patients, even though you might medically know more about them. It is their body, and you cannot pressurize them. You need to work in partnership with them, and you need to respect their decisions. Be conscientious of your abilities and ask for help or supervision wherever required. Do not try doing things that you're not fully confident about, even if you think calling a head nurse or calling your consultant or your registrar repeatedly for small procedures might annoy them. If you're not fully confident, do not endanger the life of the patient, and definitely do ask for help whenever you need to. And do not accept gifts. Do not escalate a chance meeting with patients outside the hospital beyond polite greetings. And do not connect with patients on social media, even if it might hurt their feelings. Tell them politely that you cannot do this because you have to respect your professionalism, and you cannot connect with them outside a hospital environment. And in case you do happen to run into a patient, do not bring up their appointment with you, or do not even bring up the fact that you're their doctor, because you never know who is traveling with them or who might overhear that, and that way you would be breaking patient confidentiality. So just be polite and do not interact with them outside as much as you can. We'll go through some examples. So Harrison is a pediatrician about to give Charlie, a young boy, his vaccination. Charlie is scared of needles and is being held by his mother. As Harrison is preparing the injection, Charlie sees the needle and starts crying and thrashing around. How appropriate are the following responses by Harrison in the situation? Number one, ignore Charlie and continue with the procedure. Which of the four do you think this is? So obviously, a lot of you have gotten clarity about SGD. This would be a very, very inappropriate thing to do. Because over here, by ignoring Charlie and continuing with the procedure, he is number one, undermining the patient's autonomy and the patient's feelings. He is also disrespecting the patient by not empathizing with him. And third, by ignoring Charlie and continuing with the procedure, like it's mentioned, Charlie starts crying and he's thrashing around. Charlie might actually end up getting hurt because even though it's a vaccine, it's not a very simple procedure and it's a needle that is going into your bloodstream. So there might be a mistake or an accident, and that would ultimately hurt Charlie. The second thing is to put away the needle and ask for the appointment to be rearranged. So, what would this be? Which of the four options would this be? Okay, so from the answers, I can tell that this is a rather tricky one. Okay, so a lot of you have been confused between B and C. However, the answer would actually be D, which seems confusing because, like I said initially, that there are two aspects to all questions, and the two aspects over here are number one, to make sure that Charlie gets his vaccination, and number two, to empathize with him and calm him down. So over here, by putting away the needle and asking for the appointment to be rearranged, the doctor is making sure that he's, calming Charlie down. However, it is a very inappropriate thing to do because the vaccine might be very important for Charlie, and by unnecessarily delaying it and not mitigating the situation right then and there, he's further endangering Charlie by letting him go out without his vaccination. So it would be a very important thing to do because, like I said, at the end of the day, no matter what happens, patient safety is of utmost importance. Put down the needle and try to reassure Charlie. So I'm not opening this for discussion because this is very obvious. This would be a very appropriate thing to do. He needs to put down the needle so that he doesn't hurt Charlie, and he needs to reassure him and try to understand why he's trying. And ask Charlie's parents whether they want him to continue. What do you think this would be? Can you please write your answers in the chat? Okay, so a lot of you have given your answers. The answer would be B. It's appropriate but not ideal. It's appropriate because since Charlie is a minor, his parents are still responsible for his medical decisions to the most aspects. However, it's not ideal because even though Charlie is a minor, he's still a patient, he's still a human being, he still has feelings, and right now he's the one who is under distress. So the doctor should communicate with Charlie directly instead of his parents. And the fifth one is ask his mother to try keep Charlie calm. Okay. So a lot of you have been alternating between B and C. However, the answer would be D. It's a very inappropriate thing to do because as a pediatrician, as Charlie's doctor, he should be the one communicating with Charlie, and he shouldn't add any additional pressure on the parent to talk to the child. He's a doctor and he should be accountable for the medical procedures in this case. Of course, he can take the mother's help, but over here it says ask his mother to try and keep Charlie calm. So this is definitely not going to help Charlie or the mother or the doctor anyway. Uh, okay, then there's another example after this. Ben, a third-year medical student, is undertaking a placement on a geriatrics ward. One afternoon, he sees an elderly patient standing in the corridor outside the ward. Ben does not know the patient or why they are in the hospital. Ben thinks the patient looks confused, but is not sure. So I know this section has a lot of questions, a lot of scenarios, but I thought these are important because you get a lot of questions from dealing with patients. So that's why I'm just taking a little extra time. So how appropriate are the following responses by Ben in this situation? Number one, escort the patient back to the ward. Okay, so I've written the first option incorrectly. It's supposed to be a very appropriate thing to do, the first option. Okay, so a lot of you have submitted your answers. The answer in this case would be D. It's a very inappropriate thing to do because Ben doesn't know anything about the patient. So he's just assuming that the patient is lost or that the patient looks confused. And without any details about the patient, he's just escorting the patient back to the ward, which is wrong, because the elderly man might not even be a patient in the first place. So he definitely needs to investigate more before taking any physical steps. The next question is, ask a nurse to help the patient. So can you write the answers in the chat? Okay, so all of you have, almost all of you have written the answer as B. It's appropriate but not ideal. It would be appropriate because, yes, he is addressing the aspect of the patient's welfare in this case. But again, since he has encountered the patient, he should be the one taking any steps, and he should be the one helping the patient instead of just ordering a nurse to do their job, because the nurse might also be busy, and asking a nurse to handle someone else's job might actually take time away from other patients, which would be detrimental to them. So this is appropriate but not ideal. The next thing that he could do is speak to the patient and ask if they are okay. So, okay, all of you agree this is a very appropriate thing to do. He should ask the patient, figure more details, and then tell him. Okay, the last one is, I think it's the last one. Tell the patient they need to go and get back into bed. Okay, so again, all of you agree this is a very inappropriate thing to do, because, like I said, Ben knows nothing about the patient. So just telling him to go back to bed is very counterproductive, and it's not right. Plus, it's also very disrespectful because he's undermining the patient's mental capacity by just making assumptions about him based on his perception.
Okay, so
Okay,
now
now there's
we can do the Q&A. So Archie has covered professionalism, dealing with patients, confidentiality, and teamwork. If you have any questions about this thing, Archie, can you look at the Q&A section and
sure.
take over? If you want me to go back to any slide, I'm happy to do that as well.
Okay, so someone asked me, for the question involving professionalism on the consultant's part for Cameron, is it possible that the consultant would not be swearing when the nurse is around? In that case, would the answer not be C, inappropriate but not often? For how important is it that the nurse has never seen such kind of behavior? So, one thing that we need to know is that patients actually get to spend a very limited time with consultants, whereas other healthcare professionals work in tandem with doctors like nurses, lab technicians, etc. So it is possible, it's more probable that the nurse has spent more time with the doctor than the patient themselves. And another thing is, yes, it is absolutely true that the doctor might not be swearing when the nurse is around, and only maybe when the patient is around. However, it is important to take all factors into consideration here. Cameron cannot just make a decision or judge the consultant or take any steps based on one patient's statement. She has to start investigating the matter, because that patient said that this doctor has offended me, but she can't immediately just villainize him because one patient said that he's feeling uncomfortable, especially after the fact that the nurse has said that the patient does not like being in the hospital. So it would be important, and it wouldn't be of minor importance, because the nurse gets to spend a lot more time with the doctor. And another thing, these answers are taken from the UCAT website, so it's better if you get to know or get to understand the pattern of answers that UCAT generally asks. I think there's another question. Okay. If the patient is engaging in illegal activity, what would be the ideal response, and are you allowed to break patient confidentiality? So I think this would if the patient is engaging in illegal activities, in case if you're talking about drug abuse or something like that, then no, the doctor cannot break patient confidentiality unless it's absolutely detrimental to other people or the public. So if the patient is misusing drugs, even though it is illegal to use drugs, In this case, the doctor would have more of an advisory role than an administrative one, and the doctor cannot break confidentiality and approach the police. However, if you're talking about cases where the patient has a communicable disease like HIV/AIDS or something like that, and the patient is refusing to tell their partner, or if the patient has say MS or cerebral palsy, and they are refusing to contact the DMV and get their license cancelled, in that case, since the public benefit or the public good is at harm over here, then you can definitely inform the necessary authorities. But the first step would obviously be to communicate with the patient and explain to them why they should do it themselves. Again, these kinds of questions are very rare in the SJT. They are more interview questions rather than SJT questions. So you will come across more of these cases when you're preparing for your medical interviews. Okay, I think that's all. There are no more questions in the Q&A box. Of course, if you have any more questions, you can keep posting them later throughout the session as well.
Okay, and then I can move on to dealing with mistakes.
Sure.
Right. Okay, so I'm going to talk about 4 sections, which includes dealing with mistakes. Then we'll cover fitness to practice, drug misuse, cheating, and the last one is coping with pressure, which is a very, very common topic. You can put your answers in the chat box. So dealing with mistakes, healthcare professionals sometimes can make mistakes if they're stressed or if they have a lot of work going on, if there are lots of pressure going on. The 4 steps that they should ideally take is firstly, inform the patient about any and all mistake that has occurred. Okay, offer an apology for the mistake and explain promptly what has happened and the short term and the long term effects of the mistake. Also report the mistake. And a 5th step that I haven't mentioned is to try and reverse the mistake if possible. All these are very, very, very appropriate responses, and patient safety is of utmost concern. Sometimes mistake will definitely be made, and sometimes it'll be like a near miss. So it is really important to distinguish between the both. Some very common distractors are to talk about the rank of the person who's responsible or the reputation of the person. So for example, you're like a junior doctor who's seeing your consultant making mistakes, prescribing incorrect medication, and even though the person is 20 years older to you, practicing medicine for a longer time and has a greater reputation, that reputation and rank is not important. Patient safety is more important, and scale of the mistake is also not important. For example, if the patients didn't face any side effects, you should still follow all these 5 steps, and the scale of the mistake and the degree of damage is absolutely not important, and the rank or reputation of the person is also not important when dealing with mistakes. So I'm just going to go over to one very interesting question. I'm hoping you guys can put the answers in the chat box. So this involves a medical student, Gemma, who's observing a patient consultation conducted by Dr. Mitchell, who's a consultant. He's updating the patient records on the computer, and he asks the patient whether he's allergic to penicillin, to which the patient replies yes. But Gemma notices that Dr. Mitchell types a no on the computer record. How appropriate are each of the following responses by Gemma? Should she inform the patient privately about the error after the consultation is finished? What do you guys think? Okay, mixed responses. The correct answer is a very inappropriate thing to do. I know many of you have written C, so it's not C, because a very inappropriate thing, something worsens the situation. It is absolutely worsening the problem, and according to the GMC, you should never undermine your medical field. And Gemma, in this case, is undermining the capabilities of Dr. Mitchell by going to the patient privately after the consultation has finished. The most appropriate response would be for Gemma to talk to Dr. Mitchell about it, discuss it first, because she may be wrong about this as well. Maybe Dr. Mitchell typed no and she's noticed it wrong, or maybe there's been some other discrepancy. So this would be like a very inappropriate thing to do. It's absolutely the most appropriate thing to do is talk to Dr. Mitchell after the consultation is over. The next one is very interesting again. Okay. So just think about it, okay? There are two aspects of this problem. Dr. Mitchell may have made a mistake, and the other aspect is patient safety. Is patient safety being compromised in this scenario, or is it being taken care of? Okay. So only a few of you have answered it B. The correct answer should be B according to me. 1 second. Yes, because she is solving one aspect of the problem, which is by asking the patient to repeat the answer to the question, she's making sure that the patient says the answer again and Dr. Mitchell realizes his mistake himself. And the patient doesn't get the wrong medication. So patient safety is being taken care of. But at the same time, the timing is not right, because Dr. Mitchell has already typed something, and it's such an awkward situation. If Gemma asks the patient to repeat the answer again, it could affect the doctor-patient relationship between Dr. Mitchell and the patient. So it's not the most ideal response, but it's fine. It solves the issue, so it's okay. Do you guys have any questions about this? If you do, just put it in the Q&A. This is with respect to dealing with mistakes. Now I'll move on to drug misuse. Drug misuse is part of the fitness to practice issue. And if any healthcare professional is abusing drugs, then that affects his or her health. Okay, and that affects his or her ability to deliver care to the patients, which indirectly affects the patients. So taking care of yourself is extremely important, and that's why this is such an important topic, because everything ultimately leads back to patient safety. And this relates to alcohol, hard drugs, soft drugs, any kind of drugs that the doctor or the healthcare professional is consuming during clinical work or outside work, but is impacting his or her clinical work. Some things that are very appropriate are to seek advice, discuss the matter. So for example, let's say I'm a medical student who's abusing drugs because I'm really concerned about something. I have an emotional reason behind it. The most important, appropriate response for me would be to talk to somebody about it and do something about it rather than ignoring it. So these two are really, really appropriate responses because they seek to solve the issue. If you are somebody, let's say like a junior doctor who's seeing his or her colleague abusing drugs, then you should always solve the situation locally before escalating and reporting it to the senior consultants or the medical school or the institution. Always try to resolve situations locally. Usually reporting will be considered the last response, and it's usually an inappropriate but not awful response. Patient safety, as I said, is most important. There would be questions which will check your levels of judgmentalness. So you should never be judgmental. This kind of section assesses your ability to support your colleagues, because there might be almost always an emotional reason behind somebody misusing drugs. So if the question says that the person has a emotional reason, and if some person's family member has passed away, then that factor is important to consider. It's not very important because patient safety is more important. The fact that your colleague has requested you to keep it a secret is absolutely not important, because it is affecting patients. So this part of privacy is not important. The fact that the person is your boss or has a reputation, absolutely not important. These things are really not important. Okay, I'll just move on to a very interesting question. So Beatrice is a fourth-year medical student who is on attachment to a surgical team. And this morning, the foundation Dr. Jack was late for an hour. When he passed by, she smelled alcohol in his breath. She knows that Jack has recently called off his engagement with his fiancée. How important to take into account are the following considerations by Beatrice when deciding how to respond to the situation. What about Jack's reputation as a doctor? As I've already mentioned, reputation is absolutely not important. Jack's reputation as a doctor is in the past. What is happening now is in the present. His reputation doesn't matter at all. It's the wrong thing to do, and it's not important. Not importance. What about the tasks assigned to Jack on that particular day? He's part of the surgical team, so what about the tasks assigned to him? So the tasks by themselves are really important, but think about this situation. Should Beatrice, why should Beatrice take the fact that some tasks are assigned to Jack and some are not when deciding how to respond to the situation? Is it important for Beatrice to consider? The main two aspects in this is firstly, she smelled alcohol in his breath, so he could be harming patient safety. And then the other one is the fact that he is in an emotional place. So based off this, the tasks assigned to Jack on that particular day are of no importance. Even if he just has to take patient history that entire day and not has to engage in any surgical operation, it is still important to talk to him and let him know that he should go home and he should not be at the hospital because he is most probably drinking at work. So the tasks are not important, the reputation is not important. You should still not be in the hospital because you could still compromise patient safety. Every small little detail can compromise patient safety. This is the third one. So Sam is a medical student. He's arrived at the hospital at 8 a.m. His friend, who's another medical student, joins in, and a senior consultant begins to explain that on the ward he will be introducing Sam and Alex to a patient who has a condition that they have recently learned about. And the senior consultant says that it would be good for them to find out more about the condition from the patient. But after the senior consultant finishes speaking, Alex whispers to Sam that he had been out drinking in a nightclub that day and returned home at 4 a.m. in the morning. He says he woke up late and is wearing the same shirt from night out. You can smell alcohol from his breath and clothes, but he does not appear to be inebriated. How about this? Should Sam say to Alex that if he does not go home, he will involve the senior consultant and the medical school? Okay. Okay, that's nice. I think all of you are really getting it. C is the right answer. Because, firstly, he's trying to do some good. He's trying to make sure that the patient safety is not compromised. That's the first thing, right? Patient safety should not be compromised. That's the first thing. And he's trying to make sure that he does not come near patients. So that's something good. But he's saying that he will involve the senior consultant and the medical school if he doesn't go home. This is a very threatening kind of sentence, isn't it? And he's involving medical school in the first situation. It's almost like reporting to the medical school, which is considered to be inappropriate but not awful. The first step is always to just discuss it with Alex. So that's why this would be an inappropriate but not awful response. This one is a drag and drop question. So Joe and Lionel are medical students, and Joe suspects that Lionel is stealing small quantities of painkillers. When he confronts Lionel about this, he reveals that he's addicted to painkillers. So this is like the emotional reason, okay, and begs him not to tell anybody. This is a distractor. And then Joe is torn as he feels that stealing cannot continue, but Lionel is a close friend of his, another distractor, and has been a source of support for Joe on multiple occasions. So this is another distractor. This is a very complex situation. You should always make sure that your personal feelings don't get in the way of doing the right thing, which according to the GMC is always supporting your colleagues and reporting if any mistake has happened. What do you guys think? Okay, so most appropriate. How about least appropriate? Yes, perfect. That's the right answer. Most appropriate should always be discussed openly about the reasons. He's trying to support his colleague, trying to be an empathetic, non-judgmental person. And the least appropriate would be to suggest to Lionel that he will not be a good doctor if he doesn't get help. So this is not helping anybody. This is a very condescending sentence. And is going to worsen the situation because Lionel is tearfully revealing that he's addicted. He's in a lot of distress right now. So this is not going to help him at all. It's dismissing his concerns completely. And ask Lionel how long he's been addicted to painkillers is it's in the middle. It's not really helping anybody. So it's not in the middle. It's in the middle. It's not in the extreme situation. It's not a bad thing to do. It's not a very good thing to do either. So now I'll move on to cheating. If you guys have any questions about drug misuse and dealing with mistakes, just put them in the chat or Q&A. Cheating is very simple. It's very straightforward. You will almost always know that cheating has happened in a situation. You would be in a situation where you would be asked to cheat, will be in a situation where you would be compelled to cheat, or somebody told you that they're cheating. Okay, you should almost never ever cheat yourself to gain an unfair advantage, even if you accidentally land in a position. So let's say you were going through your social media group with lots of medical students in it, and some of them posts the marking scheme of the anatomy test that is happening the next day, and you accidentally see the mark sheet. You should immediately close it, delete the post if you can, and report it to relevant authorities. That would be like the very, very appropriate thing to do. And if you are in an emotional place, let's say somebody passed away in your family, you couldn't study the entire year, let's say the entire last half of the year, and you feel like you're going to fail the year. Even if you are in an emotional place, that doesn't give you the right to cheat. So cheating is just never ever. You should always report if there's cheating that has happened already. But if a friend of yours is cheating, you should always encourage them to report themselves. If they're not doing it, then you should report it. Even if you have heard that cheating could happen, or even if it's a rumor, you should always report it. Never turn a blind eye towards anything, but you should make sure that you let the relevant authorities know that it's a rumor. These are cheating questions are really common and important step questions. So as I said, reputation of the person is absolutely not important. Relationship you have with the person is of minor importance, sometimes important, but mostly minor importance, because the way you talk to the person will define the kind of dynamics you have with the person. So if it's like a junior doctor, your colleague who's cheating, and you go and shout and yell and threaten the person, that's going to spoil the dynamics between you and the person, right? So you don't want to do that, because you would be working with the junior doctor in the future as well. So mostly in relationship questions, it's of minor importance. And a lure of a better grade, not important at all. Nobody finding out, not important. There might be situations where they say something like, you're skipping classes because you have to do some other work, let's say extracurriculars, or you want to go out party, and you ask your friend to sign you up. Okay, that's obviously cheating and it's not the right thing to do. But one of the factors they will give you is that you plan on covering the content later. Okay, that is a good thing, but it's still not important at all. You should still not help any friend who is asking you to sign his or her proxy. And the fact that what you've heard is a rumor is important. You should take that into consideration when you're telling relevant authorities, but it's not very important because cheating is more important and reporting is more important than the rule itself. Okay. And then we'll just move on to a question. This is really interesting. So a few weeks before your first year exams, your year have been given a chance to complete a mock exam. The exam will be held at the university under exam conditions. After the mock exam, you mentioned a drug calculation question which you found hard because of forgetting how to do unit conversions. Your friend then tells you that she too struggles with conversions, but was aware that one was already going to be in the mock. She then explains that she found a way of taking the information into the exam to use, but does not explain how. So how important to take into account of the following considerations for your friend when deciding how to respond to the situation. The fact that this occurred in a mock exam, is that important or not? Remember, the most important thing is the fact that cheating has occurred. That's the only important thing. So yes, it's true that it's not important at all. How about the fact that she says that she would not do this in a real exam? Do you think this is important to consider? No, not important at all. Someone said B, this is not important at all. Even if she says she would not do this in a real exam, you should still report it, or you should ask her to report herself. Nothing like that will be excused. Finding out the method by which she cheated. Not important again. The method has no relevance, even if it's like a long method or a short method, it doesn't matter. She has cheated, and that's the only important thing. This is another really interesting scenario. So you're a final year medical student in the final week. You're a final year medical student in the final week of your last medical placement, and you have a number of clinical competencies that need to be signed off by someone who's competent in that particular skill. Without having these skills signed off, you will not pass off the placement. You are aware that your friends have already completed these sign-offs and consider themselves competent. Your friends recommend that you find someone who will sign off the skill if you explain it rather than do it. What do you think? Absolutely. This is a very inappropriate thing to do because, first off, these are clinical skill competencies and they need to be signed off if you actually do it properly. And if you don't do it properly, nobody would ever know if you know how to do it, right? And patient safety is going to be compromised in the future if you don't know how to do it. So this shortcut is a very inappropriate thing to do. Now your friends offer to sign off any skills that remain on the final day. How about that? Absolutely, very, very inappropriate thing to do. They consider themselves competent, but doesn't mean that they are competent. The signing off of skills has to happen by the relevant healthcare professionals and not by anybody else. Your friends recommend you contact your placement supervisor for help. Very appropriate thing to do. Absolutely right. Somebody has sent in a question about the cheating part. Let me just go back. Cheating. Okay, cheating for the drug calculation. What if the method that you found out is used by other students? Would it then not be good if we find out the method and prevent others from using that as well? So by knowing the method by which he cheated, you might not find out if others used it. Right? Others may have used a different method if they cheated or not. But just by finding out the method itself, you won't find out if many people cheated or not. So it is not important at all. Then coping with pressure. The only underlying issue behind coping with pressure is that you need to take care of yourself. And because if you don't take care of yourself, that impacts your patient care as well. You will get scenarios like, let's say you're a medical student and you have lots of extracurriculars to take care of, and you have your medical coursework as well, and you're unable to juggle both of them together. So you want to make sure that you find a way to balance everything out and take care of yourself. Or let's say that a friend of yours is in trouble and is facing trouble at home, and is also facing trouble at the hospital because of the pressure. So you should always make sure that you support your colleagues when they need help. It's always very appropriate to acknowledge the problem, seek advice, seek help, and anything you do to solve the issue, anything that you do to take the action and solve the problem is very appropriate. You might have to compromise when you are in a situation where you can't handle so many things together. You might have to compromise by delegating things, and in many situations it's considered to be appropriate. You should absolutely never ignore the issues because it's going to grow and grow. So you should take care of the deep-rooted issue. And as many times they give this option of taking some days off. It's usually appropriate but not ideal, because it is okay to take some days off. It might help, but it doesn't solve the main issue, which will only be solved by seeking advice and talking about it and taking action to solve the problem. And when choosing between extracurriculars and coursework is absolutely more important than anything else. Always choose coursework over extracurriculars. And sometimes there would be questions in which you have a friend of yours, and that friend of yours says that I don't want to talk about it, you should leave me alone. Even though there are so many difficulties, I'd rather stay alone and not talk about it. You should respect the privacy, but if it affects other members negatively, like maybe you're being rude to your housemates or you're not doing your share of work, then that privacy is not important at all. You should still talk to the person about solving the issue. These are some sample situations that I wrote down when I was writing my test last year. And these are very common questions, actually. So this one, the situation involves two key things. First of all, there's a student who has exams and has to take care of the fundraiser. What if the person cancels the fundraiser so that he or she can concentrate on his exams? And that's considered to be very inappropriate because other people have also organized the fundraiser. You can't just cancel it all of a sudden just for yourself. So that's obviously very inappropriate. How about you leave the fundraising committee to focus on your studies? That is appropriate but not ideal because studies come first. But it's still not ideal because you're leading the committee, but other people are going to do your share of the work. So other people are burdened as well. Make sure the committee work is done at the expense of studies. Very inappropriate. Studies come first, absolutely. How about you delay the fundraiser, which means you reschedule it on a separate date? It's fine, it's appropriate and not ideal. It's something sort of a compromise. And it's the person trying to make best of both worlds, so it's appropriate but not ideal. The next situation is about clash of events. So you are a student who's leading the winter formal and you have a winter formal meeting along with the revision session at the same time. How about you skip the meeting and go to the revision session? So here you're placing a lot of responsibility on your studies. You are keeping your studies first, but still this will be very inappropriate because you're leading the winter formal. You need to be there because you're a leader. So these little details can just change the whole scenario. How about you ask the group whether the meeting can be rescheduled? It's again appropriate but not ideal because you're trying to reschedule things. Leave the meeting early to attend the revision session, very appropriate. Whenever there are clashes, you have to find ways to do both the things together, and this is the most appropriate thing. Tell her ideas and notes to another member and go to the revision session. So that's also something like you're trying to make best of both worlds, appropriate and not ideal. And the things that I've highlighted in red, they're very similar. They fall under the same band and they have this answer option. How about you attend the meeting and ask someone else for their notes of the revision session? That would be inappropriate, but not awful. Why? Because you're putting your meeting first before your revision session. That has to be on the top priority, and you're also bothering other people for their notes. So it's not the best thing. This is just one example that I have, and then we can move on to the questions. So Zara is walking to the university campus. She sees a fellow classmate, Jacob, who approaches her. And Jacob is clearly upset and tells Zara, I've just found out I did not pass all my exams. I'm going to have to repeat the year if I want to stay on the course. So he's really distressed, pressurized. I worked hard and feel that even if I repeat this year, I will just fail again. I think it would be best if I quit university. What do you think I should do? Have you thought about seeking support from the university for advice on what to do? Yes, that is very appropriate thing to do because that's directly solving the problem and you're helping him, supporting him. So that's absolutely fine. Anytime you're seeking support or seeking advice, it's absolutely right. How about this? Very interesting. Maybe you could apply for a different course, perhaps an easier one. Okay, the correct answer is D. Some people did put C. Let me tell you why it's not C, and it's D. It's D because it doesn't help the problem, it worsens it. He's already said that he works so hard and he's feeling so distressed, he's demotivated already. And if you tell him that he should apply for an easier course, that's gonna be really condescending and it's not doing anything to solve the issue right now. Because you don't really know why he failed his exams, not because maybe it's because of some other reason, not because he's not intelligent enough, maybe it's because of some other reason. And he got into medicine, so it means clearly it means that he could do the course. So this is a very appropriate thing to say. I think you should take some time to think about what you want to do before making any decisions. So this would be a very appropriate thing to say because, okay, yes, this is a very appropriate thing to say because you are supporting him by saying that you shouldn't make any rash decisions and you should take some time to think about what you want to do. It doesn't have any downsides. You're supporting the person and it's okay, it's good, it's the right thing to say. So just think about it, okay? Does she have right intentions when she's saying it? How does it sound? How does the sentence sound to you? Okay, and many people put A, B, D. Nobody has put C. So the correct answer would be C. Why? Because she's definitely not solving the issue, is she? So that's why it's inappropriate. But she's saying that I'm sure you'll find it easy to pass the exams next time. She's trying to be nice. She has good intentions. This may seem like this is a nice sentence, but she is dismissing his concerns. She's not helping him in any way. It's just he already said he worked really hard. So it's not helping him in any way. That's why it's inappropriate, but it's not awful. It's not the best thing to do. What is it? Let me just see if there are any questions about this. So if you have any questions at all, you can put it in the chat box. I can go to any other slide also if you want me to.
So do you guys have any last things to say if there's no other more questions? Anything you want to add? No? Are you guys good?
I think I just want to say that all of the SJT questions are contextual based. So we have given you some advice regarding some of the common situations, but everything depends on the context. So if there are slight details in the context that could potentially change the answer from, let's say, a very appropriate thing to appropriate but not ideal, you should be careful of that. So, Archie?
I think we've covered the most important points. I just think one thing that we probably missed is that each question should be taken individually. Like, even if it's a set of 6 questions, don't relate them. So if you've put very appropriate for one of the options, it is completely possible that the next option or the next question might also have the same answer, even though it's a different thing to do in that case. So treat them as individual questions, even though they're connected by the same passage.
Great. Thank you so much, guys. I think that was personally a very helpful webinar. So thank you very much. If anyone would like to revisit this webinar, then you can do so by visiting Virtual Med Society's YouTube channel. We'll be uploading a recording of this webinar on there within the next few days. And if you have any further questions, you can DM us on Instagram or you can send us an email. And if Archie and Sanjana are okay with it, we'll pass on the questions to them and you guys they'll be happy to answer. Thanks again to both of you and have a nice day, everyone. Thank you for joining. I'll upload our social media links onto the chat just before we leave. Thank you.